Oh, I think we're. Thanks, Kate. So welcome, everyone. We're really excited to have Colleen Pierce here from the Community Learning Hub in Lac La Biche. I've had a couple of times the chances to talk to Colleen, and she has so many great stories about how you're working at that community level and making those connections. I think everyone will really enjoy that today. Then we'll just have some resources, and just to let everyone know that our final meeting actually for this year until we get back in September is June 24th. And we have a speaker, Ashley Mollison, who's going to talk about caregivers and equity at that time. Okay. So I think now I'm just going to stop my screen, start sharing, and bring up the other PowerPoint for Colleen here. One more click, and I think I'm just about there. There. Is that showing the right things?
Yes, that's it.
Great, thank you. I'll let you lead on there, Colleen, and just let me know when to change the slide. Oh, you're just on mute there, Colleen.
Okay, am I good now?
You're good now.
Oh,
Thanks.
awesome. Okay, well, thank you so much for the invitation to share what we're doing here in Lac La Biche. And we work in a very inclusive environment. So we have Indigenous, and because we have 3 First Nations in the area, and we have 2 Métis settlements. And so we share and work a lot with our Indigenous partners. And so we can have our next slide, and I'll go over a bit what we're doing here in the hub. So we're in a building, and we have to keep transforming everything we do, because we thought we had a lot of space, but we do a lot of things. So our space changes as needed. And so our vision is changing lives through learning and connected communities. And our mission is to inspire cooperation, collaboration, and partnerships in the community to best serve all people in a safe, welcoming, inclusive environment that reduces their barriers to employment and their skills to participate fully in society. So next slide, Helen. And so there's 5 divisions within community learning. Adult literacy is that we're teaching the English language and reading, writing, speaking, listening, and in some situations it's preparing people for language proficiency for Canadian citizenship or a permanent residency. And in some cases, it's our folks that have gone to our schools that have just missed out on, adult literacy. And so another piece of this one is computer, and that's a big one. Community literacy is getting books into the hands of folks, and we have some new books that we purchase at very reduced rates, and we get those to for events and projects. And then we also accept new and like used books from people, and you can't believe how many Westerns go out of this place and come in this place, but all genres. Capacity building is that we're helping people to connect. Like, some people are good at using the computer and the internet, but they don't have access to it. And so we provide them with access to the scanner, the fax, the phone, computers. And for some folks, they really, really have trouble filling out forms, and so we help them. We have a person on part-time that does income taxes, and then for some it's forms to fill out when you get to be moving from, like old age pension and whatever. So we help in that area. And leadership and foundation is just working on innovative ways that we can reach our mission and lots on volunteerism and keeping our volunteers because we need them so much. And food literacy is huge because we're wanting it to be that food literacy is sustainable. So we have all kinds of projects. And of course, we have the Stone Soup food rescue, and we'll talk about that soon. So those are our 5 divisions, and we can go to the next one, Helen. Oh, okay. Now I've told everything on each one of these, so we can just flip through these. Sorry. I guess I should have practiced. Oh, yeah, these are okay. There you see it. Oh, okay. And community literacy. And we have a lot of events. And so Thriftmas is that we collect things all year. And then it is that volunteers wash and sort and repair. And then we have a store that, well, it's like a store, but people come in and choose things for their children or grandchildren. And then what's left over, we just let the general public come in and go shopping and take what they want. Love of Reading is February 14th, and we always promote, that's another day that we promote reading and getting books into the hands of kids. Earth, there's way more events than these ones too, but Earth Day happenings, we always, and that connects up with the food literacy. We have volunteers come in and like it was vermicomposting and planting and things. Family Literacy Day this year was about green lunches and being green, so that fit with the theme for their event this year. Fit with Stone Soup Food Center, and the food bank and all the agencies closed down over Christmas. They give them hampers ahead of time and then they close down. And so then we, in between Christmas and New Year's, that break, or we do a Hands Up for Families where we hand out fluid milk and cereal and whatever we can. So next slide. Yeah, capacity building. So a big area that we work in, I guess that I missed, was settlement services. We help newcomers and people that have had fires or that need leaving abusive relationships and need furniture and household goods. We do that. So we have access to lots of our volunteers speak other languages. So when needed, we have interpreters or translators. So next slide. Yeah, and this is that we're always working within the community to determine the needs that are, and we work with Northwest College on community adult learning needs, and we work with Prairie Vision on us specifically on they sent consultants on gaps in the food, like why people food security, and so they gave us some funding for some smaller projects, and so we've worked, and they've been really helpful in giving us ideas to keep going. So that one is, so figuring out what the community needs are important, getting out there and connecting. Next slide. Food literacy. So with food literacy, we're trying to get people to be sustainable. And so besides the food rescued, we have a program where there's a seed exchange and people can pick up seeds. We do barrel gardens, and when people can't afford them, we donate them. We have done Super Thursdays, and people from different cultures come in and cook soup, and then it's a time for people to just connect. They have soup and a bun and a dessert. And again, I thought it was the soup that thing that was important, but now I realize it's the people from all walks of life. Some people pay it forward, so we don't discriminate. If people can pay, they pay. If they can't, everyone comes in and they visit. And so it's, inclusive, that everyone is included. And we did Stop Food Waste Day, and we've got to work with Second Harvest, and we'll keep working on that one, because there's so much food waste within the households and within the like restaurants and grocery stores. It's unbelievable. So next slide. Oh yeah, those ones. Yeah, and we do have courses and mentoring, and so we have some of our elders and seniors going shopping and doing reading labels and price comparison. Yeah, next slide. Yeah, and so we're getting new signage that's in the process, but this is the door that volunteers man at 1 to 4 every day. And different foods come in at different times. Sometimes we're able to purchase food with emergency food funding and distribute that, or sometimes it's just the food that's donated by the 2 grocery stores, A&W and one of the restaurants, Lucky 15. Yeah, so that's and people wait and come on in. So yeah, you can go to the next slide. And in 2024, we rescued that many foods from the landfill, and individuals receive food. Now, some of those, they're from all walks of life, and seniors and, youth and anyone can come and pick up food, and they can come every day if they need to or want to. And the food that's not suitable for human consumption is used as animal feed or composted. So nothing goes to waste, and we never know quite what we're getting. Some days there's more food, and some days there's less, and they have to share. And so that's just how it rolls. And okay, we'll have the next slide. And the volunteers for Stone Soup, we have people from all walks of life doing all kinds of things. And like there's someone has to pick up the food from the places. You weigh it, you sort it, the storing, displaying. There's hosts every day, usually 2 or more. And then there's entering data for funders and for Second Harvest. Then we do janitorial. And of course, we work closely with our health inspector, and there's recording and doing all the paperwork for Alberta Health. So next slide. Yeah, so many of our volunteers are seniors or elders, and we absolutely are dependent on volunteers. We couldn't manage without them. And so, when you rate it at $15 an hour, and lots of these people are, it's been remodeling and tradespeople and people tutoring people, doing all kinds of things. And so it's $15 an hour is a very cheap amount. So we get a lot of value from the volunteers and what's been happening. Next slide, please. So what the volunteers have told us, it's that volunteers have an opportunity to learn new skills, and they also so because there's a variety of people from different backgrounds, it's an opportunity to learn about different cultures and different ways of life. So you get to learn lots of skills. For many, it's been an opportunity to gain confidence, because when you're the one being the host or the hostess, you're having to, instead of being the one that's coming in and asking or, selecting food, you're the one that's in charge. So it's an opportunity to gain confidence. And so many of our volunteers are so good at sharing their skills and their life knowledge and helping others. And it's for many or some of our volunteers have Parkinson's and arthritis. So it's an opportunity to increase their physical activity. And then it's an opportunity to practice and use their mental wellness as well. So it's that's what some of the things that they've gained. Um, Next slide. So it is truly, like, I can't say enough how humbling it is and how many people volunteer. And we have even some college students from India or Pakistan, and they are actually text and ask if they can come and volunteer. So it's always exciting to have so many people with, so it's inclusion, people of all ages, genders, um, cultural backgrounds. And we have a few people that one of our volunteers has Parkinson's. Many have arthritis and are getting joint replacements and whatever. We have some that have had strokes, and it's an opportunity to practice their speaking skills and an opportunity to get out and be part of the give back to the community. So with our volunteers, we always build on their strengths. And some of the volunteers said that why they really like volunteering here, because they choose the project that they're interested in. We're not telling them what they have to do. We let them choose from the list. And we always have our volunteers involved in the planning and have their say. And in the first slide, you can see a lady with hijab working closely with one of the other volunteers. And that lady came and could not speak English. And I put her in a speaking class. And her husband asked if we could move her to work in Stone Soup. And so I said to the volunteers, please involve Rose and speak with her and let her. And so now she's fluent in, well, pretty fluent in English, and she has a permanent job. But when she gets a chance, she always comes in to volunteer, and she says that we're like her family. So that's always exciting. The third picture is a lady that's from the Ukraine, and they were working, one of the volunteers, they're working on making, we get a lot of bananas and buttermilk, if you can believe it, donated. So they were working on ways to use making muffins. So that's what that was about. Next slide. Oh, and this is just to show you how many people we work with in the community. Like this, some donate funds, some donate there, like in all different ways, but it takes a whole community to keep this going. Next slide.
We're at the end there. Were there any other stories or anything that you wanted to add in there, Colleen?
Well, I just want to say that in I don't know what it's like in other people's rural communities, but in our community, it's often difficult for people to get access to resources and services. And of course, transportation plays a big, is a big problem. Keeping appointments and getting to appointments is huge. And so sometimes, some of our funders say, well, you shouldn't be working with that group or that group. That's not your mandate. You're supposed to be working on, literacy. That's what you're supposed to be doing. And, so an example was we had a fellow that was involved in trouble with the law, and he did community hours with me several times over because we have folks do community service hours or fines options, because if they don't do the hours someplace, then they have to do jail time. And my goal is always to keep people out of jail because it costs us a lot of money as taxpayers. And so this fellow then developed cancer, and it's not gone well. He's in palliative, and so then the justice system. He was to appear in court via Zoom today, but for whatever reason, he didn't show up. But if he doesn't appear in court, then he has a warrant out for his arrest. So although he's palliative, he can end up in jail and, die, or well, within the jail system or the hospital or wherever, but not with his friends or family or caregivers. So it's kind of, it takes a lot of people to, keep things going, and like interconnected services. And the other thing that I wanted to comment on, it's so wonderful to get out of your own little silo, and join and other to attend other conferences, because you realize, we're all in this together, no matter what the mandate is. So I'll take questions and answers, and if anyone has questions and answers, I'll try and answer them.
Great. Yes. Please use the chat box or come off, but just ask Colleen any questions there. She has a depth of wisdom here that we want to tap into.
Helen,
Hi, Sharon.
Can I just ask, Colleen, I know that many of the people who use Stone Soup are homeless or unemployed. And just what do you think needs to be done as far as, pathways to work if you had a magic wand, what would you do?
Well, I definitely think that they need an alternate employment or some other form of, because of addictions, they can't go to work in traditional jobs. And because of mental illness, some of the folks can't work 8 hours a day. So I think that they need to have a place that there's centers, and they get to choose which area they work in. And I've often dreamt that there's a lot of seniors that were mechanics or were whatever profession, and they could supervise and guide these folks. And you see, it's definitely not a highway paved that it's going to all go together. It's up and down, and like they have to accept and work on their gifts rather than trying to change them overnight. Like it's a long haul. But and so it's an opportunity for seniors and elders, because what I see here is the mentorship that goes on in the back is far more than the food is important, but the mentoring and the counseling and the support given by the volunteers is unbelievable. And a lot of the people have come back and said, I really appreciated that you talked to me, that you prayed for me, and I'm, like it made a difference. Now, do they go back and do the same thing? Sometimes, but it's what it is.
I think, Paul, did you have a question? I just see you'd come off mute there. Oh, we can't hear you, Paul. I'm not sure what.
Can you hear me now?
Yes, yeah, you're very quiet, but yeah, we can hear you.
Okay, so thank you very much.
Oh, no, we can't hear you now. Sorry.
Ask him to text it in the chat.
Yeah, I can put it into the chat if that's,
Okay.
yeah, that's better.
Okay. So can you hear me now?
Yeah.
Okay. So I was like, I just want to start by saying thank you, Colleen, for the presentation. It was amazing. So what I just want to know is if Colleen can share maybe email or contact for us to learn from her, because we also have a lot of challenges with the volunteer here, and the value she just offer now is another kind of like thinking. I mean, I never think it like that. So the way she present this is very like, for me, it's just like some kind of new, what will I say? New thing, I mean, new fashion to see how to do this. Sorry, my first language is French, so I'm trying to just like speak English. So yeah, yeah. So and the second thing was I was wondering if she can share that presentation with us, with people. I mean, so that we can benefit from that. Yeah.
Sorry, it kind of was cutting in and out, Paul. What I got was that you're hoping that maybe Colleen can share about how is it about how they got started and how they involve so many different groups? Is that
Yes, yeah.
okay? Great.
And
Well,
also share like maybe if someone wanted to contact her to, I mean, for her to lead us with this sort of program. So because we have a program here, we don't do it that way. So we want to learn from her. That's it.
Would like to learn from her.
Yeah,
Yes, okay, we can get her contact information and we always
yeah,
send out a follow-up email, Paul. And so
yeah,
it'll have the presentation and we can get Colleen's contact information from there. But maybe Colleen, you can speak a little bit about how you involve all those different generations in your work and
yeah,
a bit about how you got started.
exactly. Thank you.
well, initially, the program was specifically for literacy, and we had tutors working either in small groups or larger groups or one-to-one. And then we realized, or I realized, that okay, it's fine to say that you need to learn English and you sit down here and we're going to work on English. But then when you actually talked to these people and heard more, some of them were worried about what they were going to do for lunch for their kids, and a food issue. And I thought, well, okay, it's fine to be learning English, but there's other issues. And then it got that you know at that time there used to be but it got cut. There used to be a place called Job Corps, and they would send workers. And then we realized, oh my gosh, these people are having trouble with transportation. There's people having trouble with filling out forms. There's adult males that are sitting here crying because they can't fill out a form. And so then we realized, oh, we need more things. So we got more things going. And then what we realized was, okay, well, we have no money, so we have to get volunteers. And so where do you find volunteers? Well, then some of the retired teachers now volunteer and teach, tutor. There's all, and so we just keep responding to people's needs. And so then some of the board members are laughing, well, kind of joking with me, and they say, okay, you've got 5 divisions now, are you sure you don't want to start another one? And I'm going, no, I'm looking for a succession plan here. But we're really grateful. And we were doing I thought that Ukrainian food was an easy food to do at a concession booth. And I'm not Ukrainian, but I know Ukrainian food. So we did, Ukrainian sausage and cooked pierogies. And so it was down on the ice. And so then it was really, really funny because we had a young fellow that's Métis that had taken his safe food handling course, and he's cooking and very precise about following Alberta Health Services. And then we had a fellow, Abdul, And it was, he couldn't even eat the sausage because of course he can't eat pork, and he never cooked a pierogi in his life. And so those boys are cooking the pierogies as we're running up and down in the car hauling. We just get down to the ice and they'd say more pierogies. And so Abdul said, well, he never cooked pierogies before, but anyway, Abdul came as a volunteer, um, from the college, because the college has International Students Association, so they bring the folks, and so some of them volunteers. Sometimes we have, like we did oatmeal in a jar, and we try, like they also then learn about stone soup. So like it's just like, Paul, I guess it's making connections in the community, and you don't realize, like with Alberta Health Services and with probation and Alberta Justice, and the like the health unit. There's so FCSS. There's so many people we work with, and just keep connecting, and listening to what they want and their ideas, because no matter, even if it's someone that you think is marginalized and homeless and whatever, it's surprising what gifts they have if you go beyond what their what situation they're in today.
There's a couple of comments just in the comments there, so I'll just pass that on for you, Colleen, there. So just from Ginger, just to say, such an incredible heart for service and community engagement. Thank you for all you and your community do. And then Genevieve from Caregivers Alberta, thanks so much for the presentation. She had no idea how much was going on in your community. And then we just heard from Paul there. And from Ellen, what a supportive community you have created there. I think, Colleen, when we've spoken, it's just been, you have such an ability to be able to take one situation, let's say stone soup, and bring so many different kind of elements that are happening at the same time. And as you were saying, around that connecting part of it. I know when we met a while ago, you talked about that I think there's folks that if they're receiving some of the food, then there's a bit of an obligation to come and be supportive of that. Could you talk about that a bit?
Oh, that's also, I guess, people that have extra produce, like Chippewa and Prairie First Nations is way up by Fort Mac, but they grow potatoes, and so they brought potatoes, and we distributed potatoes. And another time from Second Harvest, that was a crazy, but we did it. They sent our potatoes from PEI couldn't go to United States. That was before tariffs and all the commotion, because they had some type of they believed that they had some type of a disease, but they were perfectly good potatoes. And so then I phoned the folks in Second Harvest in Toronto. Well, they had no idea where little Lac La Biche is really, nor that it's just a little nothing place. And so then we got a whole reefer of potatoes, and we called it the Great Potato Pickup. And people came from miles around. I had all the ag societies and the community groups handing them out, in the settlements and all around. And then we thought then we were negotiating with the county to see where we were going to store these potatoes. And the board member said to me, Colleen, you're never getting rid of all those potatoes. But by the end of the day, people were still driving, asking for potatoes, and we distributed them all. And so there's that. If people have extra, and it's surprising, some folks that even have like elders that can't, and seniors that can't use their crab apples and berries and things, they pick with their bad backs and knees and whatever and bring here and donate. And then we've got some elders that go and pick for other seniors that are living in institutions that because they pick wild raspberries. That's what they seem to be able to find. So they're always negotiating and asking me to come on out and pick berries, but I'm saying I just can't do that too. But anyway, yes, so there is people definitely giving back. And then the other aspect that the volunteers started was, and this is kind of a interesting, like some of the seniors had a real aversion to the marginalized folks, and when they would come to volunteer, they say, oh, what do you have those riffraff in there, and there you should just send them to jail and kick them out. And then, I would say, well, no, we're going to helping them out. And then the more they got to work with them, then pretty soon they were saying to me, Colleen, we're doing a sock drive in our community, and what else can we bring in? So then they started collecting clothes, and they were giving, out clothes. And then some of the folks were like just taking a whole bunch of stuff and then throwing it behind them dumpsters and such. And so then the volunteers again said they need to pay a little, and then it will give them dignity and respect. And so we're going to start charging. And I said, oh no, but anyway, I listened. And so now it's an ongoing thing, but we have some big garage sales sometimes. And then they sell either $1 a piece for the clothing or $5 for a garbage bag. And so people donate. And that's another aspect. Like people that their husbands have died, or their wife has died, or their mom has died, or they moved them into an institution, people really have a hard time parting with the belongings. And so when when they come here and donate, and then sometimes the volunteers say to me, Colleen, well, why did you accept that? And I go, what difference does it make? We thank them, but a lot of times it's a lot of really good things, and it's recycled around. And we have some folks that like we've got one elder that's caregiver for a lady that's incontinent, and so I don't know, they're on a real limited budget. And so the diapers are really a commodity, and so whenever they're donated, then we save them and he takes them for his wife. So that's been another whole aspect that you realize that people and families are so happy. So we've ended up with furniture. We've ended up with like anything you can imagine, just about, not pets yet. Um, not taking on that job. Uh, but it's another whole area that people are so happy that someone can use their stuff.
Hey, I see from Sheridan there, she's got, can you tell about what do we do with Grandma's yellow pie plate? Is this a
Well,
story?
we started a series. I mean, we had a guest speaker, and that's been a whole area that we had a speaker, say about the importance of preparing and knowing, what you're going to do. And so then when we started that community learning, it was good now because the Heritage Society did a whole series. And on estates and preparation, and the yellow sleeve and or green sleeve or whatever color sleeve he is. And so in the community, the library's done a death cafe now. And so it's always kind of interesting when you start something. Sometimes it gets a life of its own. And that was true that yes, that Sharon, that's right. That's who did that session. And it was fantastic. And a lot of the people that went to, that was on Zoom, and a lot of people came in from a lot of different communities across Canada for that. That was awesome.
Nice. So you were kind of the host of Dr. Bonnie Lashowitz coming to talk about that.
Yes, and we purchased the workbooks, and so that connects it all up with the literacy portion, and we have, and I guess that's another thing that we could offer again, or pass that on to the Heritage Center. Yes.
Nice. Yeah, it sounds like that's part of what you do is in those partnerings, then you might start something, but then hand some of that off to some of the other organizations that are in your community also. Although you like to do a lot, Colleen, too, I have to say.
Well, we do a lot, but it always comes that if someone in the community takes something on, it's okay too, because
Nice.
you're constantly, like, our volunteers are constantly thinking up new projects, and then what we're working on now is cultural cooking and sharing that people are more the same than they are different. And so doing, cooking a dish, and then telling the story behind the dish, and about their country, and where, the struggles, if they've had struggles, or, and I think when people hear each other and share each other's stories, and food is always the leveling, we all need to eat, and we all are trying to get food for our kids. And so you know, anything connected to food, it seems like that's the leveling. And so we do, for the volunteers, and they really, really like it. We do volunteer potlucks. And someone at first said, well, what, that's not thanking volunteers, they have to cook. But then it is that people bring food from their own cultures. And even the folks that have been here a long time, settlers from a long time ago, bring, Ukrainian food, or food from, their own countries. And when we all get together, and then afterwards they all visit, and they all say, oh, that was the best meal, and so, like, when we doing that again? So, but then we thought, oh, we would do one 4 times a year, but then spring comes and summer, and so it's usually just one in the winter time.
Yeah, yeah, that makes sense. Well, thank you. Just wondering if there's any other questions for Colleen. It's been wonderful to hear about all the different aspects, how you bring so many different things together in your community.
Well, the other thing that I don't know if I mentioned it or not, is that we're always willing to share. And we started sharing, and how we got involved in the food rescue. We went to St. Paul, a group of volunteers. We went and we learned what they were doing in their community gardens, and they do a lot of things in St. Paul. And I guess the inspiration with the St. Paul group was, like, some of their volunteers are 85 and we're still picking up food and distributing food, and that's just pre-COVID. And I thought to myself, man. And so they've been willing to share lots of things with us, and we've tried to share with what we've come along with Smoky Lake and other communities. And we've also worked with in, I think it's Pinoca, they have a school program and a greenhouse, and they have quite the program going there in connected to education. But we've worked a bit with them, and it's been at different times, different community groups. There was um, a specialty greenhouse that grew heritage tomatoes, and they had too many. And so they sent us a whole trailer load of those. Like, volunteers went in the trailer and picked those up. And so but we don't want to compete in the tomato business, because the seniors at the Lac Lodge grow tomatoes. And so we don't, there's a few people doing that. So we do, we try and not copy, or do different things. So right now the volunteers have been um, propagating um, house plants, or people bring house plants that they don't like anymore, and so then the volunteers resurrect them or get them growing again, and then we sell them for a minimal amount, and so the house plants have a new life too. So
Nice, very nice. I was just going to let people know that Kate did put in the chat the link to the Community Learning Lac La Biche, Changing Lives Through Learning in Connected Communities, and then direct link about the Stone Soup Foods program. So you can click on both of those, and again, we'll send those links out with the recording afterwards. But I just want to say thank you so much, Colleen, for coming and sharing this information. We record these, and so if people can listen to it again or share it with other people once we've sent out that follow-up email with that in there. So thanks so much, Colleen.
Well,
Colleen?
thank you,
Oh, sorry.
Helen.
Do you mind
Yeah,
if I pop your email into the chat as well? I wanted to get
You-
your permission first, but
you can put my email. You can, and
Okay.
again, you know, please be patient with us. We're so fortunate. We have a practicum student from Portage College, and we are going to be hiring her. So for the first time in a long time, we're going to have a receptionist. And Shayla is the one that helped me with PowerPoint and whatever. So I am so grateful. So be patient, but we will get back to you.
Yes, great. So I just have a couple of resources to share here. Again, thanks so much, Colleen. Just amazing all the different ways that you involve. It's a true community development approach. Oops, went too fast. There we go. So yeah, just a couple of things that I'd heard about recently that I thought folks in the community might be interested in. There's a workbook that's called What Matters to Me. And so it's around helping people with serious illness talk to their healthcare team about what is most important to them, especially around palliative and end of life types of conversations. So something you can look into there. And then just recently, Healthcare Excellence Canada has launched their Right Care Challenge. And so it's to support health and social care organizations to ensure patients receive right care at the right time in the right place, all while helping the big measurable, reduce avoidable emergency department visits. And so this challenge has a little bit less reporting and write up and that kind of thing. The awards are a little bit smaller also, but it might help spur particular projects on within there. And I guess I would always say around that, helping reduce avoidable emergency department visits, is that all the work we do in the community helps people stay in the community and stay healthy. And so that is the way that you kind of sell that when you're looking at that Right Care Challenge. We know 80% of health is produced in community through connections, leveraging resources, contributing strengths there. So I encourage people to look into that Right Care Challenge and tap into what's available there. So I think that is everything for our resources this week. So, oh yeah, that's just our contact information. So thanks everyone for coming out. Great conversation today with Colleen. And if you have any follow-up, Kate had put her email there. And so that's just super. Thanks everyone for joining today. Hope you have a great rest of your day.
Thank you very much. Thank you.
Thanks.
Mhm.